Over 300,000 people were killed by a recent tsunami. That many die in Africa every month from poverty and disease. In fact, within the next 72 hours, a child will die from malaria and hunger in rural Kenya. That child will die due to a lack of medicine and food. Compound these medical shortage problems with the fact that countless people are dying lonely, hopeless, and often needless deaths from HIV, malnutrition, and preventable diseases such as malaria, TB, and pregnancy in Kenya. Tropical Clinics is focusing its attention to addressing this health crisis. Our mission is to provide quality but affordable medical and preventive care for rural regions in Kenya and for the rest of Africa dealing with these high rates of maternal and infant mortality as well as the horror of HIV/AIDS. The need is right now. Now, here is where you and Tropical Clinics can make an immediate impact to the health needs of rural Kenya. It's very easy for us to drive down any street in most cities and find a fast food restaurant on a corner. $2 is about what your average Starbucks Grande cost, but at Tropical Clinics, that same $2 will help save lives of men, women, and especially children in rural Kenya who depend on Tropical Clinics for life-saving vaccines, nutrition, prenatal care, and much more. There is a 20-foot container stocked with much-needed medicine that is ready to be transported to the clinic at Kakamega that will stock its pharmacy shelves with medicine and nutritional supplements for the next 6 months of operation. There are physicians and other healthcare workers, trained and contracted, ready to begin their work. If you and 9,000 other people would donate $2 today, the price of a cup of coffee, we can get this container to Kenya at our already existent medical and treatment center. This crisis of medicine and essential supply shortages will be answered by setting up a high-quality and affordable pharmacy and treatment center at Kakamega. A full-functioning treatment center means that the Kakamega community has greater access to medicines and basic medical procedures, as well as tests, prenatal care, nutrition education for children under 5, and immunizations. Such services are vital in rural areas, where nearly 80% of the population of Kenya lives, and the average life expectancy is only 46 years. Nearly 1/3 of the children are underweight and malnourished. Your donation will allow Tropical Clinics to make this service a reality to many disadvantaged groups of people. Let me share a couple of stories with you. When Agnes' daughter fell ill 2 weeks ago, she put her faith in Kakamega District Hospital, the nearest medical facility, for help. She arrived there a few minutes after 10 p.m., only to be told by the nursing officer that there was no medicine. This poor mother did not know what to do as she sat there and watched her child die of pneumonia and malnutrition, both curable and preventable diseases. The hospital administrator, Jonathan, said that the shortage of medicine and medical supplies is not unique to this hospital. It is creating a trail of misery and, in many cases, death for patients across rural regions in this country. In the Kakamega region, some sick people are turning to herbalists in the hope that they can end their suffering. Aisha, who is 43 years old, has not been able to get her medicine to cure her diabetes for days. She fears that her condition will get out of hand, as she cannot afford the expensive medicines offered at private pharmacies. She stated, "I was told there was no medicine at the district hospital pharmacy. They turned me away. Where will I go with this piece of paper now?" she asked, waving her prescription in the air. Aisha thinks her hopes lies in many of the herbalists who set up shop on the streets of the town of Kakamega. The herbs are not tested and their efficiency is not known. With a donation of $2 today, Aisha will have her prescription of diabetes medicine filled at an affordable cost to her. Thank you for partnering with us to stock our pharmacy shelves with the much-needed medicine for the people of rural Kenya. By making a $2 donation today to Tropical Clinics, you'll be helping us to ship this container to our clinic. By making a donation of $2 today to Tropical Clinics, you will be helping to save a child's life. Visit our website at www.tropicalclinics.org. $2. That's only the price of a cup of coffee. You'll be happy to know that you saved a child today by skipping that cup of coffee for one day.